And why,
Absolutely.
when it comes to aesthetics, do you want to be a single driver, right?
Yeah.
It doesn't make any sense.
Yeah. There is that shift away from volumization and wanting changes in skin, wanting changes in tightness, not wanting to fill. So what we see with calcium hydroxylapatite is you get this remodeling. So we move away from just type 3 to the type 1 that we really want in our intrinsic youthful tissue.
More is more.
Yeah.
Yeah.
The person in front of us is 3D. Let's treat all the layers.
I'm here interviewing the one and only, straight out of the UK, Dr. Cara Abbott. And I'm so happy that she joined me today for the podcast. So talk to me. Where in the UK are you from?
So I'm just outside London. About an hour outside London. So,
is this your first AMWC?
No, I was here last year and a few years before that as well.
And do you also agree that it's one of the best meetings?
Definitely one of the best. So much to see, much to do.
I led the witness. So I had the pleasure of hearing your lecture this morning.
Thank you for
about calcium hydroxylapatite. So kind of tell me the impetus to your lecture and how you kind of came up with it, and tell me a little bit about your findings and all of that, and then let's get into it.
Yeah. So I am a big user of calcium hydroxylapatite, and I have been really only for about the last 4 to 5 years. I know it's been out much longer. And actually, I looked back and found my original certificate of training was 2010, and then I stopped using it completely.
Why?
I think that it just wasn't, at that time, it wasn't particularly the trend. It was hugely about HAs, particularly in the UK. Mm-hmm. So it was just something I moved away from. But then about 5 years ago, really got back into it as the regenerative side of things started to progress. So I have lectured on it a few times for its regenerative properties. And yeah, my talk was really more about how if we want to be truly regenerative, we have to think outside the box a little and not just push singular cell types, but really consider the whole ECM microenvironment and how we can stimulate that so that all our biostimulatory treatments.
So how are you
work.
doing this?
Well, this was including PRS, or we'll call a polyrevitalizing solution. And
what is PRS?
So there is a brand of polymicronutrients that we can use in the UK, and it essentially is like mostly HA, non-cross-linked HA, so no volumizing effect, but just pure HA with 59 active ingredients. So it contains coenzymes, amino acids, vitamin C, vitamin E. So the aim of that is to synergistically improve your biostimulatory outcomes.
Yeah, it makes sense. Absolutely. Yeah. So we're seeing a lot of these regenerative products come into the United States as well. We are not combining it for injections because we're not allowed to.
Yeah.
You guys are so fortunate and lucky that you can, because we do know that they work. And so why don't you tell us a little bit about the diluting and how you came up with your dilutions and your protocols that you kind of discussed in your lecture?
Yeah. So I do a huge amount of diluted calcium hydroxylapatite in my clinic. There's a real desire for it from patients because there is that shift away from volumization and wanting changes in skin, wanting changes in tightness, not wanting to fill. And that's where the diluted version comes in really beautifully, because you can say to a patient, we're not going to volumize you, but we are going to regenerate your tissues from within. Mm-hmm. The dilutions, there's huge amounts of data out there. I always refer to Alec McCarthy's paper, who really quite clearly documents the dilutions and how that impacts on new collagen formation. So like my go-to would be 1-to-1, either with normal saline or, as you say, we can mix. So mixing with something that would prime it. Just
for the people out there that don't do hyperdiluted or diluted, everyone has this loose definition of diluted, hyperdiluted. What exactly, when you are referring to diluted calcium hydroxyapatite, what is your ratio of?
So technically dilute is only for 1-to-1. Mm-hmm. So that's one syringe or 1.5 ml or cc of calcium hydroxylapatite to 1.5 of an alternative dilutant.
Whatever
Now,
it is.
Whatever you want to dilute that with.
Exactly.
1 to 2 is technically hyperdilute, and 1 to 2 and beyond, there's huge dilutions.
That's
People
right.
will go 1 to 4, 1 to 6, 1 to 8. And again, that's hyperdilute and beyond.
Yeah, agreed. So tell me about the mechanism of action that you think that the polynucleotides, the micronutrients, and the calcium hydroxyapatite are kind of adding to the skin texture and tone and the really collagen stimulation that you're trying to achieve with these products.
I think again, like I alluded to in my lecture today, is it isn't just about single cell type. So it's not just, let's just build collagen. We want the right collagen. So what we see with calcium hydroxylapatite is you get this remodeling. So we move away from just type 3 to the type 1 that we really want in our intrinsic youthful tissues is type 1. So you're building those structural proteins, but you want all the other parts of that microenvironment of the ECM to be built. So proteoglycans, new blood vessel formation. And we see that with diluted calcium hydroxylapatite.
Right.
And the thought process is that if you can push the cells in every direction, not just through, say, mechanotransduction, which is what we see with calcium hydroxylapatite, we see mechanical stretch.
You do see a lot of the things that you're talking about with just the calcium hydroxyapatite alone.
Yeah. So if you've got one way, a structural stretch, but then if we can stimulate the fibroblasts in other ways, then, for example, if you're using polynucleotides, your A receptors, if we can do that from every which way, surely that's better for our patient outcomes.
More is more.
Yeah.
Yeah.
But it's like there's, in England we have a way of saying things. There's more than one way to skin a cat.
Yeah.
If you wanted to get to a destination and your route was blocked by traffic, you'd find other routes, and you might take all those different routes. It's the same for biostimulation. We shouldn't just be aiming for one way. We need to think outside the box.
That's right. It's so funny because any other area of medicine, if you had an allergy, right, you're not going to just use an H2 blocker. You're not going to just use a steroid. You're not going to just use, a monoclinic, a singular.
You're going to use single therapy. You're going to use everything in your arsenal.
Right, exactly.
To get that response.
That's right. So that you suppress that,
Absolutely.
allergy, inflammation, which causes people to sneeze and have itchy eyes and all these, right? So why in aesthetics is it different? Why, if someone has diabetes, we have them exercise, we have them lose weight, we have them do multi-modality in every other area in medicine. Why, when it comes to aesthetics, do you want to be a single driver, right? It doesn't make any sense.
Yeah. And the lecture today also was not just on combining products, but also considering we shouldn't just be treating the superficial tissues with regeneration. We should be considering all through the layers. So again, we're not just using a single therapy. You're thinking, let's think in a 3D way, which is what we should be doing as aesthetics doctors.
Always,
the person in front of us is 3D. Let's treat all the layers.
If we don't have a good scaffolding, how could we put the tent, right?
Yeah.
So your skin is just one component of the entire picture, right?
Exactly.
So you can't focus on just the micro. You have to look at the macro altogether.
For sure.
Exactly. So that's very exciting. And where do you get your polynucleotides, your vitamins, your all of that? How did you decide the source and the vendor that you wanted to go with? So for those of you who don't yet use these products, there's so many. How many booths are there here at the exhibit hall?
A scary amount, yeah.
Yeah. So how do you pick the one that you want to use and try and integrate into your practice?
For me, it's all about research. So I am very comfortable with calcium hydroxylapatite. There's over 200 peer-reviewed papers on how it works. Therefore, for me, patient safety is huge.
It's the number one thing, right?
I need to know there's a good background to that company that's producing it, and the polyrevitalizing solution that I talk about has been around for a long time, with good, robust studies. So that's how I would choose my product. And we'll see as time goes on, how our polynucleotides and how the studies evolve from there, and they'll be great to use as well. But for me, patient safety is paramount.
So if you're injecting these polynucleotides with your calcium hydroxyapatite, those injections only take place maybe once every year, maybe, right?
Yeah.
So how do you, because when I think about biostimulation and I think of using polynucleotides, I think of how you have to kind of, when right now in the United States, I use them only on topically, right? I use them after I ablate the skin or microneedling or something like that.
Okay.
And I bring them back in a series of 3 so I get the maximum stimulation. So
In quick succession?
yeah,
Yeah.
I do 4 to 6 weeks and then 4 to 6 weeks and then 4 to 6 weeks and, whenever they want. But how do you introduce these polynucleotides another way than just the calcium hydroxylapatite?
Well, again, it always depends on the patient in front of you, the severity. So if you've got a young 20, 30-year-old, they're probably not going to need that many, perhaps. Realistically, most patients, like you say, require 2 sessions quite quickly,
sure.
2 to 3. So normally they'll be having multiple sessions quite quickly. But there's also nothing wrong with also having a singular treatment outside of it, because we're still layering, we're still working, like I said, on those multi-route applications. So I'll often have a patient that will have the combined procedure, and then 6 to 8 weeks later they'll just have a PRS or a polynucleotide, and then they might just keep that up once every 3 to 4 months.
Yeah. That's great. Thank you so much for joining me.
No, thank you for having me.